Welcome back to the show. Well, plenty of smiles this week as politicians have rolled up their sleeves to get the COVID vaccine. For weeks now, though, we've been arguing here that the government has a problem convincing everyone to have the jab. It's not just anti-vaxxers, but others who are just a little bit nervous, who want to wait a little while to see the results overseas. This morning, a study by the Australian National University confirms serious concerns about the number of Aussies still sceptical about getting the jab, particularly among young women. Let's discuss with former federal MP, Dr. Karen Phelps, and Editor-in-Chief of Stellar and Body and Soul magazine, Sarah Lamarquand. Ladies, good morning to you. Thank you so much for your company this morning. Let's break these statistics down first of all. Last August, just 12.7% of Aussies said they wouldn't get the vaccine, even if it was safe, effective and free. That's now risen to 21%. That's 1 in 5 of the population currently saying no to the jab. That's a worrying number. Significantly, there's a real issue with the number of young women aged between 25 and 34 prepared to get the vaccine. Just 67% saying yes, compared to 75% for men in the same age group. So, Doctor, to you first of all, we have a problem convincing young women to have this vaccine. Why?
Well, I think that a lot of young women are thinking, well, what if I get pregnant? Now, the point is that the vaccines haven't been tested on pregnant women at this stage. And so if somebody is not with contraceptive cover, they're likely to get pregnant, then they would need to be careful about that at this stage. That's not to say that down the track with some of the vaccines that it would be absolutely fine, but I think that the concern that a lot of younger women have is that particular concern. What we need to do is to look at a whole of population issue here, and the more people who agree to be vaccinated, and they do need to have reassurances that the vaccine is safe for them, the more people who have the vaccine, the safer our entire community is. This is where we talk about herd immunity. And
the issue here is, and we've been at pains to point this out, these aren't anti-vaxxers. These are just women who want to find out, first of all, whether or not it's going to harm them or their babies long term. So the onus is on the government to get the messaging right around this, and the chief medical officers. When you ask a chief medical officer about this, they say, well, listen, we haven't got any studies on it. Ask your GP. Therefore, that leads to more uncertainty, though.
Well, it's not uncommon in general practice for people to ask a lot of questions about immunisation. I mean, yes, parents are having to ask questions about immunisation of their children all the time, and that's one of the things that as GPs we're really happy to do, to talk people through the evidence. And as the evidence emerges, and in the United States, for example, there have been millions of people now vaccinated, so we are seeing that evidence of safety emerging, and it appears that the vaccine is very safe and very effective. And what we don't want to see is Australia left out in terms of being an international global leader in immunisation and protecting our community, and also for Australians to be able to reopen our doors, to be able to go back to being able to travel and to conduct our lives normally as we were before.
I get all of that. You're in the business, Sarah, of communication. I think the government hasn't quite got it right in terms of communication with that particular group. What would you do in terms of what you would say to women in that age group, to women who are thinking about getting pregnant? What's the messaging around that needs to change?
Well, it's fear, and the only way that you can really counteract fear is with facts. And I think this is a problem, as Karen has just so eloquently expressed, is that we don't necessarily have firm answers for that particular group because it hasn't been trialled in pregnant women. So if I was the government, I would actually be focusing on the other demographics. When hopefully we can achieve herd immunity without the women in that demographic, women between 25 and 34, necessarily being vaccinated right now. If older Australians, if people outside of that demographic, if men go ahead and get vaccinated, possibly we can achieve it. I think when you're countering fear, it's really important that you acknowledge it. And probably for me in the media, because, you know, the onus of communication also falls on us in the media, not just to the government. One of the magazines that I edit is all about health and well-being, and I think it's really important that we acknowledge the fear of our viewers and our readers, and that we say to them it's okay to work through this together, because as you say, Karl, it's not just anti-vaxxers. I mean, I'm a hugely passionate pro-vaccination person. I worked on the No Jab, No Play campaign that brought that legislation in 8 years ago, but I agree that there's other issues here. Yeah,
there certainly are. Sylvia is pregnant. I wanted to ask her, while she's here, Well, she's here for a couple of weeks, but you know what I mean. SJ, was it a concern for you? Is it something that's on your mind, being pregnant?
Well, I've been trying my very best to find as many facts on this and to find the clear information and government guidelines on this from health professionals. And at this point, being pregnant, if it were offered to me today, then I probably wouldn't have it. But I would, first of all, consult my GP on that. If I were trying to fall pregnant, then I suppose I would be hanging in doubt because I think that there have been mixed messages from the top around this at the moment, but I completely understand why there is hesitancy among this demographic because, as Dr. Karen Phelps says, there just isn't the facts available at this stage. So, look, it's a difficult one, but as Sarah said as well, hopefully the rest of the population is confident enough to help us to achieve that, golden number.
Perfectly said and perfectly surmised what's going through the mind of a pregnant woman and also women out there who want to get pregnant, all those who are breastfeeding. So what do you say?
I say that we get guidance as GPs from our college, from the Royal Australian College of GPs. We look at evidence coming in from international studies and we keep up to date with all of that information that's happening. And that's why we say to people who are thinking about vaccination, who are hesitant, to speak to your GP, get the reassurances that you need, find out the facts from reliable sources. One of the worst things you can do is to go to one of the conspiracy theory Facebook pages and be scared away from being vaccinated based on misinformation. What we need is people to rely on facts, and your GP is the best place to go to be able to talk through these issues. Given
our low rate of infection here in this country, is it okay to wait if you're pregnant and you don't want to get that vaccination? And look, I'm all for it too. There's no one more pro this than in the country than me. But I just want to reiterate that if you're pregnant or you're trying to get pregnant, what's wrong with waiting a little while then until we see some of the results from overseas before getting it?
Well, at the moment, pregnant women are not going to be offered the vaccination. We have immunisations for pregnant women, for example, for whooping cough, for influenza, without any concerns. And so I think that this is going to be an evolving situation.
But don't you think that, in a way, the fact that they're not going to get the vaccination, in a way you go, well, hang on a second, and this is we're using an abundance of caution here, but even that is like, oh, hang on.
Well, we have the public health measures that have stood us in such good stead over the last year, and it's been such a battle to get people to understand that wearing a mask is one of the best things that you can possibly do. Having the makeup done this morning, we had the makeup and hairdressing people in masks. All of the people coming into this building had masks on. People are sanitising their hands. They're maintaining physical distancing. They're avoiding crowds. So people are actually taking on board all of those other precautions. Immunisation is part of that suite of precautions at the moment, and until we reach a really substantial number of the Australian population who have had the vaccination, then we have to still continue to protect each other in those ways.
And final word from you, Sarah?
Oh, look, I just completely agree with what Karen said. You know, take your advice from reputable sources. When I've commented on this, I haven't discussed or questioned any of the medical analysis that Karen, as a highly experienced GP and former president of the AMA, has counted. What I have talked about is communication, because I think that's my role. And so don't go to Dr. Google, because there's a lot of people that say, well, I did my research, and it's not research, it's a dark corner of the web. So take your advice from qualified people.
Okay, and there's going to be a little bit of time before we have confirmation on some of those things. Okay, lovely to talk to you, ladies. Appreciate it.